Law enforcement is seeing an increase in fentanyl overdose deaths all across the U.S., and it's a problem that's seeped its way into the Oklahoma County Detention Center.
News 9's Angelicia Bruton spoke with the jail's CEO about the ways they're combating this issue.
Brandy Garner says she's addressing several issues at the jail. A couple of things at the top of her list are preventing contraband from coming in and fentanyl overdoses. It only takes a small amount of fentanyl,
according to the DEA, 2 to 3 milligrams,
to take someone's life.
It seems to be the hottest drug on the market right now.
CEO Brandy Garner says in a week they used 13 doses of Narcan, saving multiple inmates suffering a possible drug overdose. May 11th, several detainees alerted staff to 2 inmates suffering a possible overdose in a pod. Less than a week later, staff responded to 2 more inmates in a holding cell.
A lot of times we come across these people when they are doing site checks. Other times we have other detainees that are notifying us and we're responding within minutes.
Garner says her staff is CPR trained, and she says they've had to use that training a lot this past year.
We've saved 130 people. We acknowledge that there is contraband coming into the jail, and we are doing everything we can to interdict it.
She plans to stress the importance to inmates on the dangers of fentanyl and opioid abuse.
We have an organization that is sponsored by the Department of Mental Health called Shred the Stigma, and they are looking at harm reduction for opioid dependency.
Another thing she would like to do is bring in more techniques that have been used in other facilities, including bringing in more Narcan, but distributing it to inmates.
I'm also looking at a program to bring Narcan to the inmates themselves and train them on that. It's something worth trying here to try to reduce the number of people that are overdosing in our jail. It's all about harm reduction for us.
Angelicia Bruton, Oklahoma Zone, News 9.